Hi, do you own a pharmacy and want to increase your visibility to more clients? Well, it is time for you to go digital. Subscribe to the MedSearch Zambia app and let us help you increase your visibility not only to clients in your area but across Zambia. With the MedSearch Zambia app, we'll help patients or clients know where you're located, what services you offer, and what medication you have. This helping people now know more about you. Come on board, let us help you increase your visibility. Like what we say, MedSearch Zambia, healthcare.
It's time for another installment of Health Talk on Friday with MedSearch Zambia. At MedSearch Zambia, our focus is on helping all of you get reliable health-related information through platforms like our MedSearch Zambia app that lets you find health-related services easily, conveniently for you on your mobile devices. So don't forget to download the MedSearch Zambia app on your Android and iOS devices. It's free to download. Find that nearest health service provider near you and get whatever health service you need. This week on our social medias, we have been talking about a very important and very interesting topic, and this is HIV and AIDS Zambia. And all of you have been sending us very interesting questions, which we're going to tackle today around HIV and AIDS in Zambia. And we are privileged to be joined today by a colleague of mine. We're joined and we're thankful that he's made the time to be with us on a Friday evening like this. We're joined by Dr. Luunga Ziko. Dr. Ziko is a medical doctor. He is a specialist in internal medicine and specifically infectious diseases. He has trained in Zambia at the University Teaching Hospital, but also holds professional diplomas in tropical medicine from the London School of Tropical Medicine in the United Kingdom. He is also not just a doctor, but he is very experienced in management, having obtained a diploma from NIPA. He is currently working in the field as a clinician, but he is with over 10 years of experience in the medical fraternity. He is currently working as chief of party for the USAID TBLON project at CIDES. So we're very happy and very privileged to have Dr. Ziko join us today to just have a discussion. You all know that when we have these talks, it's really just a free-flowing discussion with our invited guests talking about an area of their expertise that has particular relevance to all of you, our MedSearch Zambia users and the population of Zambia in general. So Dr. Ziko, welcome to MedSearch on Friday. We're very happy to have you.
Thank you, Dr. Be part of this family, and I hope we can interact and share a few things about what's happening, especially in this particular era of HIV, and see how best we can help each other. Thank you.
Great. So I know we'll tackle a few questions from our users towards the end, but I guess a good starting point is, for me, is sometimes when you've been in the sector for a while, you kind of forget that it's still very important to talk about HIV and AIDS regularly, because we've been talking about HIV and AIDS for such a long time as a country. You kind of get fatigued and tired, and then you keep asking yourself, why do we still need to keep talking about HIV and AIDS in 2022? So maybe I'll open with, why is it still very, very important for us to continue talking about HIV and AIDS in Zambia?
Okay, so HIV, we've had this pandemic for, this is the third decade now. And we also realized that we have made great strides in the fight against HIV and AIDS in Zambia. And we still haven't gotten there yet, where we want to be. We still have lots of new infections. Every year we have over 40,000 new infections, and we still have a lot of people dying of HIV-related illnesses. We still have people having advanced HIV disease, which we also refer to as AIDS. And so that is not a good thing. For people to have AIDS, it means people do not understand that you actually have ways to identify the virus, to test yourself, and eventually put yourself on life-saving medications. Right now, when you look at the medications, they are way different from what we had when the pandemic first started. We had medications that had a lot of side effects, and they were quite intolerable. But now what we have are drugs that are very palatable, easy to take, once a day, very efficacious, very powerful drugs that can really not cure you, but they will suppress the virus to levels beyond which the virus can even have any effect on your body. And so one can actually live a life as though they are actually not infected. They can actually live a life and fulfill their their potential right from childhood and right into adulthood. So I think right now, when we look at the medications there that we have, the testing modalities that we have, which have really improved, we look at the access to the medications themselves. I think really we do not have an excuse. And so maybe the only reason why people may be shunning away from the clinics or getting the drugs is maybe the information hasn't reached each and every individual. But again, that should not be the case, because we've had the pandemic for a very long time. So everyone by now should be informed, but we can't take it for granted. We still need to educate one another and help each other so that together we can win this fight.
Thanks, Doc. You mentioned 40,000 new infections every year. That's kind of a scary number. And it makes me wonder, are we seeing a trend in terms of when we look at the figures, the new infections? Is there a particular age group? Is there a particular sex that is more at risk with contracting new HIV infection?
So when you look at, we segregate the data and look at age-specific data, we see that the adolescents, particularly the adolescent girls and young girls, are at particular risk. Looking at the age from about 15 going right up to like 25, that's a very, very risky group. And particularly the females, these are at particular risk. But when we go further up and we look at the men above 25, above 35, we also see the numbers slightly higher than the corresponding females in that particular age group. And that's why even as we craft strategies to fight this pandemic, we need to be all-inclusive. We need to identify people who are at particular risk, in this case, the adolescent girls and young women, and then also look at the men. So we see different strategies and funders have come up with. For instance, we have programs such as the DREAMS, which is targeting that particular age group among the women and the young girls. But we also have seen, I think when you go in the communities, you see men's clinics, because we know it's not very easy to get populations of particular interest.
Yeah, it is very difficult to get the men to come into health facilities. So Dr. Ziko mentioned men's clinics, and I think these are in most of our health facilities now, and these are the clinics that are meant specifically for us as men, where we can go and be attended to without having to worry too much about who's seeing us. So it's important that we know that there are these services. I'm just trying to think, you mentioned that young girls, adolescents, from the age about 15, at a very high risk. And I'm trying to think around issues to do with, I am a young person, I am a young female, I'm 15, I'm 16, I am just about to, or I've just had my sexual debut, and I'm not getting information, or I'm getting the wrong information. I know that we have things like men's clinics. Do we have, and you mentioned dreams, in our government facilities, do we still have youth-friendly facilities that are packaging material and healthcare specifically for young people in a safe space for them at the moment?
Oh yes, yes, we do have we do have youth-friendly corners in the facilities, in many facilities, government facilities. In fact, I would say majority of the facilities are encouraged to have these youth-friendly corners where the adolescents, the young girls, can go and have discussions amongst themselves. You know, sometimes when peers meet, it's actually easy to share experiences, and in the presence of someone who is an expert, that person would now be able to bring certain things into perspective and bring solutions to some of the challenges that they share. And we also have many partners who are targeting this particular age group and trying as much as possible to reach the need of this particular individual. We know that some of the things that play a part illiteracy levels, and I think we've seen government drive to ensure that as many of these people can get educated. And education is a good basis for people to be informed and be empowered. We also have certain programs that are, for instance, they're funded by the USAID. We have what we call the Empowering Children and Adolescents program. I think this runs in about 6 provinces where adolescents are identified. They are empowered with information, empowered with the ability to get a health service, quality health service. But that is not the end. They are also empowered in other aspects, and education, business, and sometimes even supply of foodstuffs. Yeah, so I know of many programs that are going around in the country. We mentioned the Dreams, which targets this age group as well, including special populations such as female sex workers. They also need particular information, because you cannot win the fight against HIV if you leave out certain populations. So it's an all-inclusive program.
That sounds very, very interesting. So I want us to kind of walk through the journey. I'm going to use the example of a young person. I'm a young girl. I have recently started a sexual relationship, and because of lack of access, lack of information, me and my partner, we've been having unprotected sex. And I'm worried that I could have been exposed to HIV, could have contracted HIV. And I've been thinking about getting a test. So, but I'm worried about what it actually involves, what an HIV test actually looks like. Because I've heard all these stories that they'll draw a lot of blood, they'll do all sorts of things to confirm your HIV status. No, you're too young, you have to go with your parents to get an HIV test. So I'm heading to the facility, but what does it actually involve for one to get a test? How do I get tested for HIV?
Okay, so one, by simply getting to a facility, you tell the facility staff what you want to do, and they will obviously offer you counseling first. And so you will be counseled, you'll be told you'll be taken through the basics, what HIV is, how it comes about, how one gets infected, what are the consequences of you getting infected and getting treatment, the consequences of you getting treatment while infected. And it's an exhaustive counseling process. You are told also the other side of the coin. What if you get a negative test? What should you do afterwards? So you're given different scenarios, and just to prepare you. And once that is done and you're ready, you feel you're still ready to do a test, the test will be done. And it's not not much blood is drawn. You actually just pricked on your finger, and just a bit of blood is put on a strip, and you wait for about 10-15 minutes, and your result will be ready. After that, it will be communicated to you, and the implications of whatever result you get. We also have what we're calling the test and treat. So if you are tested, your result is positive, you will be encouraged immediately to get on to treatment. And maybe later in the discussion, we can discuss why you should start treatment immediately, as opposed to what used to happen previously, where one's CD4 count would be expected to be very low before they would start treatment. So those are some of the issues with associated with getting a test. But talking about tests again, we also have new innovations. There is now what is called a self-test kit. So if you want, once you are counseled, you can actually get a self-test kit. And I'm also aware that you can actually walk into a chemist and buy a self-test kit. So for you to get a self-test kit, that should probably also imply that you have done a self-counseling, or you have gotten information from somewhere, and you're ready to do an HIV test. And so once you get a self-test kit, you do it in the comfort of your home. Go into your house. It's all confidential. You'll be given instructions on how to do it. Once you do the self-test and it is negative, you are also advised to do a repeat test in the next 3 months, especially if you have had a risky behavior, or you could have been exposed to HIV, because you could have a negative test that could imply that you haven't just created enough antibodies. Antibodies are simply part of your immune system that's been created to identify the HIV. And so if those antibodies, if the HIV has just been in the system for a short period of time, the antibodies will not be there within that short period of time. So that's called the window period. And so during that window period, you could be infected, but a test will be negative. And so you'll be encouraged to do a repeat test in 3 months time. But if your self-test is positive, you are encouraged to go to a facility to do a confirmatory test, which will be done by a facility staff. So those are some of the ways in which one can actually have an HIV test.
Great. I think we'll come back and talk a little bit more about the self-test kits, because I can see how it would be, and it can make life much easier for all of us in being able to test ourselves. But I also think about, could it be abused? Could people self-test, and then if the test comes out negative, then it kind of gives them like a license to say, oh, we're negative, we can now proceed to have very risky sexual encounters, and just the need to, even with a negative test, there's still other things. Just because you don't have HIV, you still need to use protection to prevent yourself from getting all sorts of other sexually transmitted infections. I think we'll talk a bit more about that. But I want us to, just to continue with the scenario we're rolling with, where so this young girl comes in and she does do her test, and it turns out she's negative, but she's really worried that her partner, it was a risky sexual encounter, and she's worried about, she might be negative, but she's worried about her partner. Is there anything, are there any medicines that we can give her in that situation that could potentially prevent her, should her partner turn out to have been HIV positive? Can we protect her from contracting HIV after the encounter?
Yes, so we have basically two main options. There's what is called post-exposure prophylaxis, and there's what's called pre-exposure prophylaxis. So if this individual had a sexual encounter within the last 72 hours, which is the last 3 days, and she presents to the facility worried that she could have been exposed to HIV, we could put her on antiretroviral drugs, ARVs, which she would take for a period of 28 days daily, just like any other individual who is infected. So if this person begins this therapy within 3 days or within 72 hours, and the earlier the person starts this, the better. So you don't have to wait till the 3rd day. So if it happened in the last 2 hours, 4 hours, that's you even have a much better chance of preventing infection. However, so one would take these for 28 days, and after that, they would have to be subjected to a test, and then if negative, subjected to another test at 3 months, just to ensure that there was no infection involved. And during that period, this person would be advised not to engage in any sexual practices, any unprotected sexual practice. So that's what is called post-exposure prophylaxis, which you only initiate if the last act occurred in the last 3 days. The pre-exposure prophylaxis is offered to individuals. Such an could be infected or not sure about her partner and still has continued interaction with her partner. Should be offered what is called pre-exposure prophylaxis. These are also ARV drugs, but these are taken for a period, for as long as this individual is at risk or perceives a risk of infection. The disclaimer here is that protection, a woman would be deemed protected if she takes the drugs for a period of 21 days, after which she can engage in that risky sexual practice. Whereas for men, they would only have to take it for 7 days for them to be protected by that particular set of drugs. The difference is basically in how we are made. Men and women are different in our physical state. So that's the reason why women have to take it for 21 days, after which they should engage. So it also means that a woman or a man should not engage in unprotected sexual practice before the 7 days for the man and before the 21 days is completed for a woman. So those are the two options that I would offer such a woman, and I would need to engage her to understand the scenario or how her situation is exactly.
Great. So the PEP, the post-exposure prophylaxis, and the pre-exposure prophylaxis really sound like they are just one of the tools that we have in trying to reduce transmission and just thinking around high-risk populations. Earlier, you had mentioned, for example, commercial sex workers who, just by the nature of their work they do, they are at high risk. So they would probably be people who would benefit from pre-exposure prophylaxis, post-exposure prophylaxis. I'm also thinking maybe in relationships, discordant couples where one is positive, the other is negative, and you're trying to protect the one who's negative and try to keep them negative. I think these are tools that sound like they are very useful and very effective in keeping those who are negative to remain negative.
Yes.
Maybe just a question. Sorry, Dr. Mata. One of the questions that we've received is, are these services for free of charge? Can one person come to the hospital and say,
Yes.
yeah, I'm married to my partner is
Yeah.
positive. Can I start? Are they going to be charged? How free is it free of charge for anyone?
So ARVs are free, whether given to someone who is getting them for the HIV infection or for prevention. All these services are free. And even when you go to a private facility, a private hospital, the drugs, you will not be charged for the drugs. You will only be charged for the consultation. So these
Okay.
drugs are actually free of charge, and you can visit a facility. So when it's not as easy as you go to a facility and you say, I've come here for PrEP. You will be assessed. So I'm saying this because there's criteria, for instance, for one to actually get the PrEP or for one to get the PEP. The post-exposure prophylaxis, for instance, should only be given to one who has had an encounter in the last 72 hours. That's when it is effective. Beyond 72 hours, just like I think in the maternity wing, you have, is it the emergency pill, which can only be taken within a certain
72
period of
hours.
time before you can say it's effective. That's the same thing. So one would have to be assessed before you are advised what medication or what preventive strategy is ideal for you. Yes.
Right. So let's flip it to the other side. So I've done my test, and it turns out that I actually am HIV positive. You had mentioned test and treat. Just walk us through that. What does that mean, and why do we want to treat early for those who do test HIV positive?
So test and treat is simply a strategy where you do not want to delay any further when one has an HIV test that is positive. So you do not want to delay any further. You want to give treatment as soon as possible. And the reason for this is that previously you would wait until someone's immune system is severely deranged or compromised, and the outcomes were actually very, very poor. But now you want to give ARVs to someone whose immune system is still intact, so that you avoid that immune system from going low, where that person will be prone to various infections. So in this case, what we're saying is that the drugs are given to this individual when the immune system is intact, to maintain it at that level, so that this person's immune system will function just as good as someone who is not HIV infected. So that's the reason why you want to test and treat, give the medication as soon as possible before that person becomes prone to any infections.
Zanga, I don't know if you have you want to come in, or otherwise I will just keep talking.
I know. Back to PrEP and PAPE. There's a question again. Sorry, Dr. Ziko. Maria Kalokoni is asking, so if someone's viral load is undetectable, let's say they've been on treatment, and our target is to have a patient or a client having an undetectable viral load, should they still continue taking medication?
Okay, thanks. That's a good question. If our target when someone starts taking medication is to suppress the viral load, right?
Yes.
We can only suppress the viral load when that person is taking medication. Once that person stops taking medication, the viral load is going to rebound. And when the viral load rebounds and gets high, it starts suppressing the virus, the immune system. So maybe let me also explain it in this way, maybe coupling it with the previous question. The whole purpose of taking ARVs is to suppress the viral load. When you suppress the viral load, this is the viral load that will actually suppress your immune system. So once you suppress your viral load, it means your immune system will remain intact. And if your immune system remains intact, it means you will not be prone to infections. If you are not prone to infections, it means you have a good quality of life. And I'm just explaining briefly the goals of treatment. You have good quality of life, and eventually you will not be able to transmit the virus to another individual. So on the other aspect, maybe we can tackle it later. But coming back to your question, if one stops taking the medication, the viral load will go back up and it will start suppressing the immune system. So that is not something that you want. And you also risk developing or creating viruses that have mutations. So I'm sure we've heard about these variants in COVID. Also in HIV, you have variants or mutants, viruses that have mutated. And these viruses will mutate particularly when they have been exposed to drugs and then you withdraw the drugs, or you have erratic intake of those drugs. So you don't want such a situation. I hope I answered that.
Very loud and clear. I'll push it to Mata. Keep on checking for questions.
Sure. Dr. Ziko, you talked about the goals of treatment and quality of life. And then you also mentioned by taking your ARVs, you're suppressing the viral load, which means that you are not going to transmit it to another person. I think for some time now, we've been talking about eliminating HIV globally, and Zambia is on board with that, and their targets that as a country we're trying to get. And I think one of the slogans we've been using is undetectable equals untransmissible, which literally means if we can get those people who are HIV positive to be on treatment, then they are virologically suppressed, then it means they're not going to transmit. Then hopefully that 40,000 new infections we talked about right at the beginning will start to go down, right? So that we want to get to a point where there are no new infections.
Yes. So really, the goal or the key in this fight against the HIV is, number one, to identify those individuals who are infected. Identify everyone who is infected. Put everyone who is infected on treatment. If everyone who is on treatment takes the drugs in the way they have been prescribed, we're going to achieve undetectable viral loads. And research, science has proved that any individual that has an undetectable viral load. So when you say undetectable viral load, it does not mean you have no HIV in your body. It means your HIV load is very low, below a certain threshold, such that the machines cannot detect it. And in that state that such an individual is, it is impossible to transmit HIV to a partner. So the key is identifying individuals who are HIV infected, put them on treatment, attain viral load suppression and undetectable viral loads. And we are going to significantly reduce transmission or new infections of the virus, of this particular virus. And that is the key to epidemic control or controlling this particular pandemic.
I'll jump in here and shift gears a little bit, and I want us to talk about some myths, because Anga used the word cured, and we know there are all these myths around HIV, fears around the medication. People say once you're started on these medications, they have all these side effects. Your skin will change color. People will be able to tell just by looking at you that you're HIV positive, because the medicines make you start looking in a particular way. And Zanga, you can jump in, but what are some of the, in your practice, what are some of the more common myths around HIV and HIV treatment that you've encountered, and how do you counter them?
Maybe
Yeah,
before you come in, Dr. Ziko, just connecting or contributing to what Dr. Matal said, we had posted this during the course of the week. And for me, who's been under ART clinic, you think everyone knows, not until you go to the community, then hear now all sorts of stories. So one of the myths was we can't share a cup with someone who's HIV positive. A person who's taking treatment, their hair looks like they've got wet look. My dad talked about having patches over the skin, so we're able to tell. And those were some of them. And if you're pregnant, if you give birth, your child definitely is HIV positive till they die. So maybe those are some of the myths that are in the community.
Okay, so it is some of those would actually, I would say, were true. So I used were past tense. I mentioned earlier that some of the drugs that were being given a long time ago were very, very toxic, and we have actually we have banned their use. And so they had very, very bad side effects. Those were the only drugs that we had. They were saving lives, but they also had some bad side effects, skin manifestations. Sometimes you would have changes in body weight, disproportional weight gain. You would have even things like hair loss and things like that. So they had some bad side effects. And that's why I mentioned that the drugs that we use now, every drug has a side effect, including paracetamol, Panadol, Amoxil, all those drugs have side effects. But the side effect profile of the drugs that we use now is very, very minimal. I'm sure we could have some colleagues, some friends who have joined in or who watch this, and they will agree that the side effects are very minimal. You would not even tell who is taking drugs and who isn't. You wouldn't tell who is infected and who isn't, because of how good the drugs we have now. So some of the myths, let me tackle, for instance, the issue of a woman who is HIV positive would definitely give birth to a child who is negative. That is not true. If that woman is HIV positive and is not taking medication, the chances, so it is not 100% likelihood, the chances of infecting the child are very high. If this woman is taking medication and has a suppressed viral load, the chances of infecting the child are actually 0. Undetectable equals untransmittable. Applies also to mother-to-child transmission. So the key there is about, is this woman taking medication? Is this woman's viral load suppressed? At which point did this woman get infected? Because why that is important, if maybe let me skip that because it may confuse. But those are the main issues. Is this woman taking medication? Is she virally suppressed? Those are the key questions. I think some of the other myths are that if I am HIV positive and my partner is negative, then we cannot have a child. Again, that is a myth. It gets back to the original principle. If I'm taking medication and I am virally suppressed, I can have an uninfected child with my uninfected partner. So those are the simple principles. Take medication and detectable viral load, you will not transmit the virus to another individual.
Maybe not to take long on the topic. We'll jump to the government. I think together with WHO and UN, we have the 95, 95, 95, and also to have by 2030 not to have any new infection. I would want you now to focus on that and also talk about the prevention of how can one prevent. I think maybe just highlight it again, especially for young adults.
Okay, so it will take us back to what I mentioned earlier, that the key to fighting this is to identify all those individuals that are HIV infected and put them on treatment and attain virological suppression. So previously we had the 90-90-90 strategy,
Okay.
which meant that the targets were that we needed to identify at least 90% of people living with HIV, test them, identify them, and the second 90 was that those people who are living with HIV who have been tested, at least 90% of them should be put on treatment. The last 90 is that of those 90% of people living with HIV who are on treatment, at least 90% of them should have virological suppression. So these targets ended or expired in December 2020. And thankfully, Zambia was one of the few countries in the world that attained the 90-90-90.
Wow.
So I know one of the myths is that we are very far behind and things like that. Zambia is actually providing top-end drugs, top-end service to people that are living with HIV. So that's one of the things that we need to be proud of as a country, but we can still do better. And that's why we have the 95-95-95 strategy, where we need at least 95% of people living with HIV being identified, being tested, and at least 95% of those who have been tested being put on treatment. And then of those that are on treatment, at least 95% should have virological suppression. So these are very key strategies to ensure that we have epidemic control and we avoid new infections. Again, when you look at even that strategy, it gets back to the basic that I mentioned, that our target is to have virological suppression eventually. Our target is not just to identify people, but to have virological suppression, because that is what is key. When someone has virological suppression, this person, first of all, is protecting themselves from having an immune system that is going to be suppressed. So this person has, number one, is going to maintain a good immune system, going to be able to fight diseases, and will be able to be productive, because once you are healthy, you are not visiting the facility every now and then. You are actually productive. If you're a business person, you will have good returns because your body is able. If you're a builder, a carpenter, you will be able to work well. So we shouldn't just look at this from a shallow point, but look at it also at that particular level. of productivity. We want a productive nation. So you can actually connect taking ARVs with GDP, something that is very interesting. Then you, apart from looking at all those, you
We can't really get you. Yeah.
I think Dr. Ziko has been invaded by a new panelist. While we wait for Dr. Ziko to come back.
Okay, I'll be back shortly.
All right, no problem.
No problem,
Mata,
Doc.
maybe like we're now concluding. This is like 45 minutes. We want to reach no new infection by 2030, which is a very good goal.
30.
Yeah. Where we stand, what should we do as a nation? Already there's a question from Maria Kalokoni again. And we also want to say hi to Madame Fofana from Senegal. So MedSearch is growing. So she's watching us from Senegal. The question is,
nice.
For this couple, one partner is serious with taking the medication and the other partner isn't taking medication. How would you encourage them?
Well, that's a challenging situation, but it's something that we face every day, right? Obviously, you encourage the partner who's okay. He'll come. You know me. I like to talk.
So, Dr. Ziko, there's a question.
Go ahead, Dr. Mata. Go ahead, Dr. Mata.
It's a tricky one.
Yeah, you're correct, but for me, it's several things, right? So one, it's supporting the partner who's taking their medication, and also finding out from the partner who's struggling with taking their medication, why are they struggling with taking their medications? Because until we find out the why, I can give you all the pills, but if I don't get to the bottom of why are you taking the pills, maybe you're having side effects from the medication. Maybe we're asking you to take the medication at a time that's not convenient for you, and it's just you're supposed to take it at night, but maybe you're a shift worker, and every time you go for work, you forget to take your medicine with you. So there are all these reasons that can contribute to someone not taking their medicines, and that's why counseling is very important. And for partners, all of our ART clinics, I think the way they're structured is whenever you have couples that are taking medicines, you want to see them together. So people get fast-tracked in our clinics so that the couple can be seen together, they have the same appointments, and they can be counseled at the same time. I think that's one of the approaches we could possibly take.
And then the other thing that was really pushing people away was the pill burden.
Yeah, I was going to ask, I actually want Ziko to tackle this, because I don't like taking pills, right? And when we started the therapies, it was a bunch of pills. So Dr. Ziko, maybe as we approach the end of our talk, would you talk to us about some of the new things in terms of treatment? I know we're down to 1 pill a day at the moment, which is great. But if there was a way for me not to have to take a pill at all, I would sign up for that. So are there new things in the pipeline in terms of how people can take their medicine that will not involve me having to take a pill every day?
Yeah, Dr. Mata, you're right. When HIV started, the medications, someone would actually get a basket of drugs, and very cumbersome. We have different, can I say, regimens, but the most common is where one takes 1 pill per day. In certain instances, especially when one has resistance, when resistant viruses, you would actually give them more drugs because they failed that line that has only one that requires a person to get one pill. So the appeal is that make sure that the one pill that one is taken religiously, because if you do not take it religiously, you are going to develop resistant viruses, and when that happens, you start taking more than one pill per day and more than once per day. With that other one, you just take one pill either in the morning and that's it, or in the evening and that's it. But what's in the pipeline? Um, it's important for us to know what's happening. We have injectables that are in the pipeline where one takes a long-acting injectable for as long as once a month, or even up to once in 2 months. So those are things that are being developed. And of course, we will not expect that this will be rolled out to everyone, but there will be a criteria um, for people to get this particular one. So just important that you also know about this one injection that you just take every month or every 2 months. I also know of things that are being developed where you get a patch. I know you have heard of painkillers, like a fentanyl patch
Even the
or
Fenner
a
patch.
painkiller. I'm sure even those who watch football, you've seen footballers just getting a patch on a particular area where there is an injury. So that patch slowly delivers that painkiller into the system. Something similar is being researched where you get a patch and slowly the ARVs are being delivered into the system. Very, very convenient if you ask me. So those are some of the things that are in the pipeline that we may need to know about. And of course, once they are readily available and Zambia is able to provide them, the public is going to be notified.
Two questions before we close. The first question, I don't know why people always ask questions at the end. So one question is with herbal medication. We have seen many people, I think I haven't connected to religion now. We've seen many people stop taking ARVs and start taking herbal because the herbalist said if you take this medication, you will be well. We have seen some pastors who say we do cure HIV and AIDS. The person is prayed for and they stop taking their treatment. So I don't know if you have a comment on that one. And then the last one is someone who's asking, I think this was during the COVID time. With COVID, we had seen so many variants coming from everywhere. But with HIV, the virus is different. Why was it that the COVID-19 we had to find the vaccine very fast within a short period, but HIV and AIDS has taken all this long? Sorry for the tough questions.
Okay.
I'm just reading them.
Okay. Maybe let me start with the last one. I think I may have forgotten the first. You remind me when I'm done with
All right.
this one. So when you are developing any medication or any vaccine, you actually need a lot of money. There is a lot of money involved. Let's look at how HIV came and how HIV has affected the world, the globe. Over 60% of the HIV. So some of these things that I'm talking about, the statistics are not my opinion, they are facts, but some of the things I'll say are my opinion. Yes. So over 60% of the HIV is in sub-Saharan Africa, particularly Southern and Central Africa, Eastern and Central Africa. Whereas COVID affected the entire globe, it brought down economies. Look at what happened in the US, the UK, Europe, Asia. It brought down economies. So there was that will from the people who have the money and the resources to quickly develop something that will be able to protect them. And that's why even in the uptake of the vaccine, the COVID vaccine, you have more people who have gotten the vaccines in those developed countries, and less people have gotten here for various reasons. Some of them with myths again, thinking that people would want to kill us, and yet if they wanted to kill us, they would simply not have given us the vaccines
They are
themselves. So
putting a
that's another
microchip in
subject.
us.
Yeah, all those myths. So it's because one of the main reasons in development of any pharmaceutical product is money. These things come at a very huge cost. So billions of dollars were invested by people from the West, people who have the money, because they wanted to protect not only the globe, they were mostly interested about their economies, about their people, because COVID affected those people more than it affected people here. When you look at vaccine development for HIV, I'll tell you that this is not an opinion, but it is a fact. There have been vaccines that that people have tried to develop, but most of them have not passed, including here in Zambia. Okay, including here in Zambia. Now, what is involved in assessing whether a vaccine will work or not? You need to give it to people and allow them to be at risk of that particular infection. Okay, so if you want to assess whether a COVID vaccine will work, you simply give it to people like me and everyone else and ask them to just move around, just be themselves. Because how do you get COVID? By breathing and touching things that may be contaminated. And that way, you will be able to assess the effectiveness of the COVID vaccine. Whereas for HIV, when you give an HIV vaccine and you want it to work, how will you know that it will work? You need to ask someone to go and have a risky behavior, unprotected sex with non-infected individuals. That is not ethical, number one.
Yeah.
And number two, very few people would really want to be part of that trial. So it will take you a very long time for you to come up with a considerable study population that you will be able to have enough reasons to say this works and this doesn't work. Whereas for COVID, we had a lot of people in the West who participated in the trials. For the Pfizer, there were as many as 43,000 individuals who were part of that trial. AstraZeneca, Johnson & Johnson, there were beyond 40,000 people who were part of those trials. Whereas for HIV, it would take you a very long period of time. And there were many trials, over 90, over 100 trials for COVID that were let me say there were over 100 vaccine candidates, several companies in the world to assess whether the vaccines were working, but only a few of them, less than 20% of those vaccines passed the test. Whereas for HIV, there've just been very few vaccine candidates. And so all of them also did not really make the cut. So those are some of the reasons that have that we can say we do not have a vaccine for HIV yet, but there are vaccines that are being tested as we speak today.
Okay. My first question was with people stopping to take medication because they're taking herbal medication, and some have gone to church,
all right,
and
I got
the
that one.
prophet just tells them you are healed.
All right, thanks for that. So again, I would want to state that I'm also a Christian. I believe in God. And even the God that we believe is one who does not shun medication. For those who are Christians, you remember the story of Naaman, where he went to see a prophet in Israel, and Elijah told him to go and bath in the river Jordan 7 times. Okay, so even as Christians, you take medication with faith, knowing that the God who gave wisdom to man to make those medications will heal you, or rather not heal you, but will protect you. So I am not saying that God cannot heal. God has the power to heal any manner of disease, but we should not take God for granted. God has given us medication, and that's why there are hospitals, even mission hospitals. In those mission hospitals, they give medication. Okay, so even as Christians, we should still be able to put faith in God, but also do what we can do for ourselves by taking these medications. In terms of herbal medication, there are many herbs that we know that can help boost your immune system and all that, but there is none that has been shown to kill the virus. So there is none that can heal you from HIV. The medications can just be used as supplements. And even that has to be done with caution, because we know that there are a lot of herbal medications that have toxins, or rather, they also have side effects. If you go to UTH, you go to what is called the renal or the kidney unit. We have people who are in there because of herbal medication. Herbs have damaged their kidneys or damaged their liver. So let's not just say because they're herbal medications, then they don't have side effects. They also have side effects. And we should not substitute the drugs that have been shown to protect us and to give us good health with herbal medication. Herbal medication can be used as a supplement, but also with caution. That's what I would say about that question.
As we come to a conclusion, I'm already saying we're past 1 hour. There's always one question that Dr. Mata doesn't like me asking people, but at least when I ask people that question, I see more downloads of my app.
I never said I don't like it.
So, Dr. Ziko, do you have our medical application on your phone? Moment of truth.
No, I don't.
I'm waiting for a day when someone will say they've got the app on their phone.
The first honest guest we've had.
Yes.
Zanga, he's the first honest guest we've had.
Okay. We've come to the end. Thank you very much for all joining us. The MedSearch Zambia app is a medical directory that we created as MedSearch Zambia that is helping you be able to have easy access to health information, be able to know which is the nearest hospital or pharmacy where able to do an HIV test or buy the self HIV test that Dr. Ziko was talking about. We hope, and since Dr. Ziko is here, we hope to work with partners so that we're able to add all HIV screening facilities in Zambia so that people, it become easy for anyone now to be able to go and get their medication, or if they're in a new town and they don't know where to have to be screened for HIV, the application will be able to do that to them. Dr. Ziko, we really appreciate for finding time on a Friday. I know it was family time, but you appeared on our platform, so we're very, very grateful. Hope you'll be able to download the application. It's for free of charge, both on Android and iOS.
iOS?
Yeah.
All right, okay. All right, so we'll have a chat, because I'm also interested in other diseases that we can add there.
You see, at least. Okay. I'm a good marketer.
Zanga.
Here at MedSearch Zambia.
We'll talk after.
Yeah,
okay.
Here at MedSearch Zambia, we always say MedSearch Zambia, healthcare simplified. See you next week, Friday. Bye, everyone.
All right, thank you.
MedSearch Zambia app, healthcare simplified.